Hey, Brandon. Wait, I gotta get comment pin. It's being weird again today. Um, let's see. Hey. What's up, guys? I'm going to get started in a second. Today is a very deep conversation. I'm going to provide a little information about the history of AIDS, HIV, and we are approaching the 40th anniversary. And so it's a big deal. And so I want to make sure I share this information with you all, and we have an open discussion about the progress we've made to date. So glad you all can join. As usual, my phone's been weird, so I'm posting the comment. Just want to make sure that you all know that we are still doing HIV and STI testing. And you can get that if you need it by calling us or emailing us. It is by appointment only, so be sure to call or email us at the number or email address I am pinning right now. Bam. All right. Oh, my necklace is showing. All right, so hopefully we got our comment pinned. What's up, everybody? All right, so I'm David Wilson, if you don't know who I am. I am a Whitman-Walker influencer. I am part of our community health team, and we're just here to give information, and do particular outreach events via social media. My pronouns are he, him, his, and you can call me she if you like. I don't mind it. But today we are going to talk about something that's extremely important. It's been 40 years since HIV, so some would consider that an anniversary. I like to say just commemorate that with 40 years of us identifying that this is something that we have to work together to overcome. And so I want to give a little information and history about when we first discovered HIV, and then it was only identified as AIDS. But stepping back, I'll give a history. We'll walk through where we are today and some of the revolutionary science that have come to play to get us where we are today. So just bear with me. I'm going to go through the history, which honestly is pretty dark and sad. But we'll get towards where we are today, where it's a lot more positive, where we have things available to those people who are living with HIV. And if you have any questions, feel free to drop it in the comments, and I'm just gonna dive into our session today. So just stepping back. So in the period between October 1980 and May 1981, 5 men who were all homosexual were treated for pneumocystis carinii pneumonia. And that occurred at 3 hospitals in Los Angeles, California. 2 of the patients actually died. All 5 patients have confirmed cytomegalovirus, which is an infection, but also they had candida mucosal infection. The 5 patients that were described in that CDC report, and that CDC report was actually written on June 5th, 1981, were previously extremely healthy gay men between the ages of 29 and 36 years old. Their illnesses and their deaths marked the dark dawn of the recognition of AIDS. And the HIV and AIDS pandemic has now been with us for 4 decades. And at least 32 million lives has been lost. There are many histories of HIV and AIDS. There are countless stories of loss, of activism, of rage and resilience, and of scientific triumph after years of futility and suffering. There are lessons about the essential roles and investment in science, and all too many about equity, justice, discrimination, stigma that we have still yet to learn. The pandemic continues, or the epidemic continues, even before the setbacks that were caused by the COVID-19 pandemic. There were 15 years between the emergence of AIDS and the development of an effective antiretroviral therapy in 1996. It took years before it had become clear that the disease was not restricted to gay and bisexual men. Although that early association, the stigma and the shame that it was attached to it in that moment, it still exists. In the USA, the cohort of people with hemophilia who received a pooled plasma, basically like a donation, were virtually all infected with HIV. And that was and it wasn't until that point that an HIV test was identified to screen blood products for folks who were receiving blood donations and things like that. The retrovirus that was the causative agent was finally identified in 1983. That discovery soon led to the first HIV test and the recognition by 1985. That HIV infection could be asymptomatic. So before 1985, we didn't even know that HIV could be asymptomatic. We assumed that if you were living with HIV, that you had to have symptoms. And we learned in 1985 that was not the case. Ronald Reagan was actually the president at the time, and the established Association of AIDS and Homosexuality was actually extremely slow to respond to the epidemic. Activists who were watching friends and lovers die brought new methods to fight against HIV. It's really where we get that form of activism we have today. They targeted entities that had rarely faced public scrutiny, and those entities included like the U.S. Food and Drug Administration, the pharmaceutical industry, and other non-responsive governments. Activists continuously educated themselves about everything from whether it was, trial designs, antiviral mechanism, like literally everything they could discover about this virus. They fought for and gained seats at the table, and they changed the way medical research has been done ever since. It would take hundreds and hundreds of clinical trials of multiple agents and combinations to achieve effective treatment. And that's what led us to the first triple drug antiretroviral therapy, also known as ART. And it worked. The first successful trial results were actually presented at the 1996 International AIDS Conference in Vancouver. But we will have no treatment for most people living with HIV for years to come. It took a while. Most of the HIV patients on ART, again, that's the antiretroviral therapy, were in high-income countries. You think USA, Europe. But most people who were actually living with HIV were in low-income and middle-income countries. So you think Africa, South America. This time period between 1996 to 2003 was the height of where we lost lives to AIDS. In 2003, George W. Bush's State of the Union address marked a pivotal change in the progress of the fight against AIDS. Bush announced that the U.S. President's Emergency Plan for AIDS Relief, which is also known as PEPFAR, he announced that plan. And by 2005, with the creation of the Global Fund to fight AIDS, tuberculosis, and malaria, including PEPFAR, the money finally began to flow that we needed to fight this virus. What followed was unprecedented. A global advocacy to global and political struggle to dramatically reduce the cost of therapy. The annual cost at that time for therapy in the U.S. was somewhere around $22,000. That drastically increased somewhere to around $50 per year for lower income and middle income countries. So that was a huge impact. It made treatment feasible at a much larger and vast scale around the world, actually. So death rates declined. Mother to child transmission slowed. New and better drugs and eventually more potent preventative tools were discovered and developed. And it was an increase in massive public sector investment in HIV research. Now today, I guess closer to today, in 2017, for the first time ever, more than half of our global population living with HIV are receiving antiretroviral therapy. That's amazing, right? That includes like a record of 19.5 million folks who are receiving therapy. Organizations around the world started to endorse U equals U, which means undetectable equals untransmittable. This is an anti-stigma slogan which is based on scientific evidence that people who adhere to treatment and achieve an undetectable viral load cannot pass the virus on. New infections have fallen by a third in East and Southern Africa and South America over the last 6 years, with particular decreases among women and girls. Today, we have several treatments for HIV, and we have prevention tools like PrEP, MPEP, condoms, other barriers, and HIV treatment. So, and you can also reach out to us at Whitman-Walker if you are in need or curious about any of those items I just mentioned. So, as I mentioned earlier, we are at the 40th year of the HIV/AIDS epidemic. So I do want to take a moment to remember the lives that were cut short by this terrible disease, this virus. That includes so many people whose pain went unacknowledged for far too long. We also want to celebrate the resilience and dignity of the over 38 million people worldwide, including approximately 1.2 Americans living with HIV. That marks 40 years of HIV and over 40 years of community health care for Whitman-Walker Health. I want to just say that is 40 years of caring for those who were often turned away, 40 years of fighting the fear and stigma that came with HIV, 40 years of advocating for public health support, intervention, and funding, 40 years of volunteering time, empathy, heart, and dedication, 40 years of providing substance use treatment services, and 40 years of helping people die with dignity. 40 years of marching past the White House and down Freedom Plaza. It's been a hell of a 40 years, right? But all of that work, all that commitment, it led to so much. It led to volunteering as an AIDS buddy. It led to the oldest medical legal partnership in the nation. It led to HIV and hepatitis C clinical research at Whitman-Walker. It led to HIV mentorship programs and HIV peer counseling programs. It led to creating the AIDS Education Fund and the AIDS Education Hotline. It also led to Max Robinson becoming the namesake of Whitman-Walker's clinic in Southeast Washington, D.C. It led to Magic Johnson sharing his HIV status and increasing HIV awareness in Black communities. It led to candlelight vigils with Elizabeth Taylor and Judith Light. That led to the creation of the AIDS quilt by Cleve Jones and community. That led to local Washington, D.C. heroes, HIV activists, doing their parts to fight HIV. That led to documenters and photographers who preserve all of this history that we mentioned. That led to 35 years of AIDS walks to raising funds to fight HIV with the 2021 walk and 5K to end HIV on October 23rd. So make sure you're there. You can register for that event actually at the walktoendhiv.org. And now, with all of this work, all this commitment, we have multiple treatments for HIV. We now have HIV prescription assistance programs so people, can get access to the care that they need. Now we have prevention tools like PrEP, and condoms, as I mentioned earlier, and other barriers in HIV treatments. We have scientifically proven strategies like U equals U, which means undetectable equals untransmittable. We have decades of clinical HIV research that help pave the way for COVID-19 vaccines that are safe and effective at preventing severe symptoms and hospitalization and death from COVID-19. And now I would like to announce that Whitman-Walker will open a new medical home in Southeast Washington, D.C. It's coming to St. Elizabeth campus in 2023, where we will be able to deliver even more care and services to our community. I do want to add, and before I close today, if you have any questions about anything I mentioned, please drop a comment. Whitman-Walker is open for free HIV and STI testing. You can call us at 202-797-4443 or email us to make an appointment. I pinned it down at the bottom of the chat. But also, before I close today, I want to remind everyone about the COVID-19 pandemic. If you want to get vaccinated, there are dozens or so walk-up sites throughout DC where you don't need an appointment. You can just go and get your vaccine. If you want to get tested or vaccinated for COVID-19 at Whitman-Walker Health, you can call us at 202-207-2480 or email us at appointments@whitmanwalker.org. We'll be registering people for the vaccine at our outreach events too. So if you see us at Pride or any of the events, feel free to join us. Feel free to come up to us. We can register you there. If you've already got your vaccine, congratulations. We're happy that you did that. Thanks for supporting your community. The CDC has given you the okay to relax some of your mask wearing habits and return to some pre-pandemic activities. However, it's still totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective, so that's one reason you might want to wear your mask. So there are no protocols in place to actually verify what folks around you have actually been vaccinated. And you can't just go be like, let me see your vaccination card. That's not going to work. So you've probably gotten used to your mask anyway at this point. So if that makes you more comfortable, continue to wear your mask. If you haven't been vaccinated, please continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and everything else. And it's very important that you get the vaccine. I will say that again. It is very important that you get the vaccine. Discuss COVID precautionary measures with those around you and be mindful of wearing masks and keeping your distance, especially when you don't know whether or not a person or persons have been vaccinated. It's really up to all of us to stop the spread of COVID-19, so please get your vaccination. All right, so that was probably the deepest live I've ever delivered. I hope you appreciated the history, but I also want you to know that we've made a lot of progress in the fight against AIDS, and here we are standing in 40 years right now. There's still work to do. There's still a lot of science and discovery we have to do, but we've made a ton of progress over the years, and I'm happy that I was able to share that information with you. To continue to get information like this from me, my peers at Whitman-Walker, please continue to follow us on Twitter, Facebook, Instagram at Whitman-Walker and at Real Talk DC_. You can also follow us at The Corner DC_ to stay up to date on all things Whitman-Walker Health. I want to thank you all for your time today, and please join me in the future. Have a great one. Oh, wait. I'm looking at the comments now. My phone froze, so I couldn't see your comments while I was Yes, thank you all. Oh man, I feel so supported. So today was a great session. I hope you all have a great one. And happy 40 years to the progress we've made to the fight against ending AIDS, HIV. So have a great one.